Let's talk about menstrual cramps. The medical term is dysmenorrhea. Now, there are two main types. We have the primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea because it's not associated with any disease, and secondary dysmenorrhea because it's associated with a disease. Now, with the primary dysmenorrhea, there is no known cause, but then these are the risk factors. 1, when you are a smoker. 2, when you are overweight. 3, when you've not given birth before. 4, when your first menstruation is at a very young age, usually below 12 years. And 5, when you have a positive family history of dysmenorrhea. Now, what causes this painful menstruation? So, in the body, there's a substance known as prostaglandin. Now, during menstruation, prostaglandin is released to help the uterus contract very well so that menstruation can occur. Now, in the process of contracting the uterus, it constricts the blood vessels too. And as it constricts the blood vessels, blood does not get to the uterus, and this causes the pain that you feel during your menstruation. Keep this in mind because it influences our management for dysmenorrhea. Now, for secondary dysmenorrhea, it's usually associated with diseases like fibroid, endometriosis, inflammation of the female reproductive tract, usually called PID, pelvic inflammatory disease. I'll expand on this later. In my next video, I'm going to talk about how to treat painful menstruation. Please, if you find this video helpful, like, comment, share, and follow me.